Time. Katie Walderman reporting there. Dr. Helen Wall joins us now. Good morning.
Morning.
I mean, we were just talking about Karen's case. I mean, it's an extreme
case. It
case.
really stops you in your tracks, doesn't it?
I mean, what do you do as a GP if someone like Karen presents herself to you?
Well, I think the first thing to say is that this is a very extreme case and there are things we can do, but Karen's the kind of patient, if I was sat in front of in my room, I would just feel really, really upset for and sick for, really, because I know that she's already tried so many things and they just haven't helped. So really the scope of this is supporting her in the hope that things will start to improve. But, you know, there are things that can be done, but a lot of people don't know about this condition, so we don't really know how common this condition is. You know, if you look at the prevalence figures, they range anywhere from 1 in 50,000 to 2% to 9%, depending what source you use. And I think that's probably because it's quite underreported. Because I think if you say to somebody what's hyperacusis, they often haven't heard of it and don't know that it's actually a medical problem or can be a medical problem that they can come and seek some help for. So
typically, I mean, I'd never heard of it before today. Typically, how does it start? Like, there are people, aren't there, who get irritated. I'm one of them, irritated by certain noises or excess noise. And that can be, that's personal, you know.
Yeah, but it's a sound tolerance.
Exactly. Yeah. But when does it become hyperacusis?
I think, as you said, everybody has a varying sound tolerance, and that can vary from day to day. If you're stressed, if you're agitated, if you're relaxed, your sound tolerance can change. But when it becomes hyperacusis is when it starts to affect your day-to-day life, where you actually can't function properly. So, and it can cause not just irritation with this, it's mildest form, anxiety, pain in some cases, severe pain, as Karen said in that VT, right up to sort of not sleeping and it affecting every single part of your day, not being able to work, not being able to function in a family, go out for day trips, or even go to the shops. It can be really, really debilitating.
I suppose one of the things about this is that, on the whole, when we think about problems with hearing, it's to do with not being able to hear well enough, isn't it? About loss of hearing. In some ways, this is, if I understand it correctly, it's almost the reverse of that, which is something that's so intense or a particular reaction. Because most people associate hearing loss as being the problem area with hearing.
Yeah, and sometimes this can be secondary to a degree of hearing loss. So our first thing as a GP would be to ask for a hearing screen or an audiology assessment to look at exactly how the ears are responding to sound, because it can be an inverse situation where suddenly they become more sensitive because the sensitivity of the hearing has gone down. And it is also associated often with tinnitus, although not always, which isn't that ringing in the ears.
And that's very different to this.
It's very different, but they can happen together. Not everybody who has one will have the other, but we do often find that people who have tinnitus, which is the ringing or humming in the ears, which can be very debilitating, also is far more common, but people often report this increased sensitivity to sound as well with it.
Helen, thank you very much. Dr. Helen Wall, just talking through that condition for us. It's one of those stories, isn't it? As soon as you start talking about hearing issues, and it's when you talk about tinnitus as well, which I know affects a lot of people, you start thinking about it, whether or not there is an element. Yeah. You know, you do start thinking.
You start trying to listen.
Which is a good thing, because you're sort of conscious of things.
People should seek help if they are struggling.
Yeah.
I think the key is if it's affecting your everyday life, your quality of life, that is when you know there's a problem.
Absolutely, yeah.
Helen, thank you.
Thank you.
Saturday morning, 9:26.
We're with you until 10 o'clock, and then